Hello all, in this video I would be talking of physiotherapy, community-based rehabilitation and what are the benefits and a small initiative to create more awareness about community-based rehabilitation. So physiotherapy as a profession basically gained importance during the time of World War II, where there were a lot of individuals who were injured on a very large scale and the need for rehabilitation aroused then. So that is the time when a large group or when a large part of the community was rehabilitated, and slowly and gradually from there the community physiotherapy or community rehabilitation emerged. Now community rehabilitation and community-based rehabilitation are two words which are used interchangeably, and most of the people do not know the difference between two. Community rehabilitation is basically the place where the rehabilitation is going to take place. And when I talk about community-based rehabilitation, it is a complex term where there are various different parameters that come into picture. Here, not only the patient, but the relative of the patient, the caregiver of the patient, the social, economic, the financial status of the patient, and what are the preventive strategies which can be used, all these things are borne in mind, and then the rehabilitation is decided. That is when you say that you are doing a community-based rehabilitation. Now we say that the orthopedic physiotherapy, neurophysio rehab are all the cardiorespiratory physiotherapy are the branches which are commonly preferred by people. But you will rarely see people taking community-based rehabilitation or community health as a subject of their masters. When survey was done and a poll was conducted to know the reason behind why as to this subject is not taken as a subject of specialization, most of the individuals said that they aren't aware of this field. Most of them said that there is no scope of this field in India. Most of them said that although they have a liking, but there is not much that they knew as to choose this subject as their choice of preference. Hence, I would like to tell what is the scope of community-based rehabilitation. So, when you are a person who is specialized in community-based rehab, you look into various aspects. So, you are treating the disabled, the entire community as a whole, keeping in mind all the individuals in the community. Okay, you get to work in a group of NGOs or in an old age care settings, or in organizations where they are believing in the development and in the rehabilitation of the individuals, either those who are less privileged or those who are suffering from any kind of ailments. Also, when you are a specialist in community-based rehab, you get to work in an industrial setup where you check for the effects that the individuals are facing while sitting as a desk job worker or doing a particular job for a prolonged period of time. Now, not only these, but if you are a specialized person in community-based rehabilitation, you get opportunities in private and government setups, also in places where they look after the chronic healthcare management of the people, where there are a lot of people and you need to rehabilitate or create a better place for those individuals together as a whole. Not only this, but there are avenues for you where you can choose academics. You can join a physiotherapy college and work there as begin with a lecturer, an assistant professor, and then the ladder moves up. So these are the various fields in which you can take up after you are done with your community-based rehabilitation or community health specialization. Now, in a place like India, where the population is just exploding day by day and there is a lack of healthcare facilities, you often see that there is a healthcare debt because of this, because an increase in the number of population and a reduction in the healthcare facilities. So when you go to treat an individual, it is a very difficult thing and it is a problematic situation. So it is always better to take up community-based rehabilitation, where you can target the individuals or the community as a whole and treat a group of individuals rather than treating just one person at a time. Because of this, you will cater to the problems of many individuals. I hope I have done my bit of creating a small awareness regarding community-based rehabilitation and the importance for the same. If you have any further doubts regarding this, please feel free to contact us. Thank you very much.